going to take over screen share. And Andrew, whenever you're ready, you can start recording.
Go right ahead.
All right. And why don't we get started? Welcome, everybody, to the June 9th, 2022 edition of Cells to Society seminar. We're delighted to have speakers today who Hans will introduce in a moment around the theme of human behavior, and in this case, taking a health perspective on that topic. So I did want to say a little bit about what the Cells to Society seminars are and where we're headed with this. Overall, our goals, again, are to catalyze cross-CALs and really cross-university pollination and meeting people and leading to collaboration and improved problem solving by weaving a stronger network across colleges and departments and again throughout the university. So this seminar series is meant to be an opportunity to do that. And as some of us were saying right before we started the seminar, it can be challenging to think about your work as you prepare to present it to others who aren't in your discipline or aren't in related disciplines. And so part of that is fun and part of it is frustrating. And I appreciate the speakers taking the time to do that because I think it makes it a more rich experience for everybody. I want to quickly thank Andrew May and Hans Estrin, my most close collaborators on this in terms of getting these seminars organized and scheduled, with thanks to the others listed there for previous and continued support. You can always see what's going on with Cells to Society seminar in terms of our schedule and upcoming events at go.uvm.edu/cells, 2 society seminar. The link is there in the bottom left-hand corner. Again, we do these seminars monthly up until a quarterly break when we do a out-of-the-box quarterly brainstorm session where we actually take a break from the presented seminars and get into some much more engaged and interactive collaboration around some themes and project brainstorming and maybe even putting together grant proposals eventually. So what that looks like specifically is here's today, June 9th. June 9th, our theme for the Cell Society seminar is human behavior. On July 14th, our plan is to have an out-of-the-box brainstorm session again. And I think we'll be soliciting input on themes for that. And so you can always send those using the link there, send those to us using the link there on the bottom left, Cells to Society Ideas. It's just a little form that we use to collect input for seminar ideas, but also for brainstorm session themes. And going all the way through December there, we have at least the start of ideas for themes, and I think some of these have actually been confirmed since I last updated this slide. But in August, we'll have a seminar theme of agritourism. September 8th, we'll be hearing from the leadership of the Food Systems Research Center, the ARS Climate Change and Food Systems Centers. And then another brainstorm session in October, economics in November, and nutrition in December. Again, you can always see what's going on and what we have planned at the Cells of Society page. We also have a YouTube channel, and on the YouTube channel are the recordings of each of these seminars. So if you miss one, you can always catch it in your own time using YouTube. So with that, I'm going to hand it over to Hans Estrin, who I think will introduce our speakers for the day.
Thanks very much, Chris, and welcome everyone. It's great to see you all in this early summer vacation, so to speak. And yeah, we were on the theme of human behavior, our little triple team, and our threesome was, scratching our heads in a way on this, on the stuff with vaccines and how it was politicized. I probably don't want to speak for everyone, but a lot of people, are just, we've never seen anything like this before. And so we kind of put this out, and Matt, I reached out to Matt and he jumped on this in a just wonderful way. And Matt's a researcher, writer, and producer of multimedia producer in CDAE, evidence-based communication, really to promote pro-health, pro-social, pro-environmental causes. And he's working with Finlay, who's in the medical school, and both of them are going to tag team a presentation specifically on strategic communication around. Well, we'll see. I'm not going to say it, but um, it's a fascinating and timely topic as we are all sort of grappling with the events of the world and some of this health stuff that has come out with the global pandemic and how it's linked to human behavior. So without further ado, I will hand it over to Matthew. Thank you so much, and Finlay as well. Thank you for joining us today and putting in the time to put together a presentation.
Well, and thank you very much indeed. It's fun to be here, and I was really thinking very much in terms of the fact that everyone's going to be in a summer mindset. So hopefully this will be a fun time for everybody today. So here's the wonky name of this, the transdisciplinary approach, creating effective health communication. And more importantly, all together now is really the theme here. And we're featuring a bee inside a desert flower from a photo taken about a week and a half ago. I'm blessed to have my wife's folks live in Arizona, beautiful part of Arizona. So we're going to feature 3 analogies today, starting out with the bee. We'll get back to that in a moment. We've got the solar system, and we've got tendrils. So our first analogy, a cross-pollinating forum. Here's this little guy doing his job to make a beautiful desert and sustain his own kind as well. And when I saw this, I said, I was in the mindset of this presentation. I said, well, we got to have a picture of this little creature doing his job. Our second analogy has to do with the tendrils. We'll get into that more a little bit later, but we're going to talk about the why of partnerships, the why of evidence-based health communication, and we're going to do that through 2 case studies. But first, I really want to make sure that I thank our organizers today, because it's such a smart idea what you're doing. I've been in private industry way longer. I've been in academia, and it's pull up the drawbridge. I got mine. Good luck getting yours. It's very hard to collaborate productively without sort of the knives being out. Academia definitely gets it, but we're often tied up and tied down by our specifics of everything that we need to do in our little narrow areas, and that forces us to get too narrow. And yet potential collaborations are absolutely everywhere. And our modern problems they absolutely need complex and diverse skill sets. And look at that, I missed a K in my skill sets. So this is my sort of shout out to Hans, Chris, and Andrew, but it's also, let's keep doing this. Let's just in general as a philosophy, because it's what it takes. Okay, so your humble storytellers today, me, I'm currently a lecturer in CDAE, and Finlay, who's got a longer history than I could fit on this slide here, but she's currently a medical student at Larner. So, introduction. The characters in this story are one organization, the NNECTR. We'll get to that in a moment. It's basically an organization made up of multiple partners from different organizations. And again, we'll get back to that. 2 people, myself and Finlay, from outside of the NNECTR. And originally we did not know each other. This brought us together. And we've got 2 different projects. I'm going to talk about one, she's going to talk about the other, but they're both focused on the same problem, which is raising HPV vaccination rates in rural areas of northern New England. So that brings us to analogy number 3, which is the solar system. So NNECTR brought us together. There's me, there's Finlay, and we're in the orbit of NNECTR. The background of the project. NIH has a goal. They want to, among many goals that they want to raise HPV vaccination uptake in middle and high schoolers in rural northern New England. It's a 5-year project with the possibility of renewal. Why? Well, it's a sexually transmitted disease. It can lead to cancer. These cancers are very unpleasant cancers, cancers of the mouth, cancers of the anus, so on and so forth. And yet there's one vaccine in the world that prevents multiple types of cancers. It's easy, it's safe, effective. If you get it young enough, it's a 2-dose regimen. If you're a little bit older, it's 3 doses. So obviously there's a really good reason to get it when you're younger. And rural northern New England lags behind urban areas in terms of vaccine rates in general, not just rates for HPV. So what do we do? All right, well, that's the problem. That's the existential problem. What are we going to do? And I'm putting it in quotation marks. Let's run an ad campaign. We'll do a cute cat or a talking lizard. And the answer is no, 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 which brings us to the most famous anti-drug ad ever produced. I'm sure that I don't need to show you the next slide because you already in your head know this very simple voiceover. This is drugs. This is your brain on drugs. Any questions? And you probably know this even if you didn't live through when it originally came out in the 1980s. So, kind of a rhetorical question. Was this a successful ad? And think that through in your head for a moment. If so, why was it a successful ad? And here's the really troubling part. How do we describe successful? So it's the most famous anti-drug ad ever produced. It was widely seen and praised to this day, widely awarded as well. But the effects were never rigorously studied. And even if they had been, an ad by itself is almost never enough to change behavior. You can get short-term effects in some cases. It's usually a much bigger process. So there's a lot of wishful thinking going on with that sort of let's create a big flashy ad and solve a problem approach. So we're going to get back to our egg a bit later. We know, fortunately nowadays, that we need to do better than that, way better than that. So these are really new days in that transdisciplinary approach. This is very new stuff. So where do we start? We need a framework. So we're going to talk about some guiding principles for a moment when you go into this kind of work. So these are the sort of philosophies that inform the approaches for both Finlay's project and my project. Skill sets and collaboration. An acknowledgement of history, the importance of integrity, and then the importance of transparency. And we'll go through all those briefly. Number one, skill sets and collaboration. The project number one is a multi-party venture. I'm going to mention most of the parties, but in the interest of time, I'm going to focus on 2 of them. The NNECTR, Northern New England Clinical and Translational Research Network. It's HQ, well, the co-HQ is at UVM Medical Center. It's a federally funded partnership. These CTRs, these clinical and translational research centers are around the country in different places. And this map shows you that the main partnership is UVM and Maine Health. University of Southern Maine is in there, as well as the Dartmouth Primary Care Practice-Based Research Network. Don't worry, don't get caught up in the acronyms. I just wanted to give you a little background on that. And I'll just be quiet for a few seconds and let you read through a very excerpted series of the NNECTR's major aims. So I think right from the start, you can see that NIH is very interested in this transdisciplinary, multidisciplinary approach. So that's NNECTR. Now, my professional bio, I've put a little butterfly here because I think of myself as kind of a dilettante, a jack of many trades, a master of none. I've done a bunch of different stuff in my career. You can see these things here. You know, writing, producing, researching, teaching, and applied communication and evaluation and PR and I really enjoy, as Hans was saying, the evidence-based communication, particularly in the realms of health and in the environment. But the common thread here for this butterfly, this dilettante, is how do you use persuasion science and media messaging to prompt people and policymakers to make better decisions about their health on the planet? It's a big deal, and it's not solvable by running a simple ad. So other sectors that were involved in this partnership, people from public health, I'm going to give some names right near the end of my part of the presentation, community health, epidemiology, biostats, social media marketing, persuasion science, oncology, media strategy, and more. So we got a bunch of people. So we've got a goal, we got a whole bunch of skill sets at the table. So what's next? What's our next step? Acknowledgement of history. As William Faulkner said, it's part of our lexicon in the English language. Is sort of a cliche nowadays. The past is never dead. It's not even past. And it's amazing how true these words are. They keep coming back. We have this picture from sort of the 1800s on the left, and oddly enough, and just in a completely discordant sort of fashion, Kate and William decided to go on a similar tour of former and present British properties, if you will, in the Caribbean just this past March, with all the horrible symbolism that's involved with that, and were justly criticized. So colonialism is very much alive, and basically it's about notions of superiority regarding other cultures and they permeate our relationships. And here's the really tricky part. It's not only about how countries or regions or races or religions view each other. Culture can lead to disappointing outcomes right here at home, because a culture can be as small as a neighborhood or a town or even a few streets. One of my favorite ethnographic studies ever was about a small neighborhood in Chicago, which was known as Teamsterville, and an early ethnographer was studying patterns of speech and it's basically about concepts of manliness there. Well, if you want to talk to those people there, you're not going to talk to them even the same way you're going to talk to the next neighborhood over. So I'll just let you read this wonderful quote from some critical health theorists. So that's what it's all about. And as I even talk to my students sometimes, DEI, obviously we have to do it for social justice reasons and for a million other really important reasons. But even at a more basic level, when you're in this health comm realm, you need to understand who you're talking to. What you say doesn't make any difference unless they're hearing it. All right, so now we've added a perspective about how to approach and work with communities. What's the next step? All right, let's go to integrity. This is another kind of fraught history and a cultural mismatch. The ad biz. I was in the ad biz. I don't always like to openly admit that. I qualify it by saying we were in the research and multimedia production and creation business back when I had a couple of companies. But unfortunately, it's an industry, we worked with a lot of ad agencies where every child is above average. Thank you, Garrison Keeler. And so I'm going to give you some cautionary words based on self-ethnography. And if I said personal experience, you'd be like, oh, that's cool. But if I use the word self-ethnography, you're like, oh, all right, now I can really believe this guy. Anyway, when health campaigners interact with media professionals, think about that fried egg commercial. When I do that to create campaigns, different cultures can lead to very different and conflicting aims. The health campaigners, the people with the money, the funders, they want to see results. Ad pros want to show they delivered them for very obvious reasons. You show a record of success where every child is above average, then you get your next project. I hear it. But there's this broad perception that things like your brain on drugs, that ad worked. And the problem is if you're in the industry, whether you produce that ad or not, are you going to question that narrative of success? You're absolutely not going to. You're going to say, this is what we do. We get great things done with our ads. So you absolutely, I'm going to give you my self-ethnography here, my personal experience story, but this, I cannot emphasize enough, repeats itself over and over and over and over and over daily in that business. So once upon a time, my former company, which was a media messaging, multimedia production, and a research company. So we made music, we made animation, we made video, we did all sorts of stuff like that. Once upon a time, we conducted the research and produced the messaging for a campaign to promote HIV testing for all people. This is a screenshot from one of the pieces that we created. This was a multimedia piece created for a website. So a different ad agency hired by the funder placed the media. That means they bought ad time on various online media channels to promote what we had produced. Then the agency produced a report, an analytics report for the client. Like, here's what happened. Here's a screenshot from that report. And I could talk about any of the items on this slide. I have almost randomly selected the 6,588% increase in website visits compared to the same length of time period prior to the campaign start. So that's the one I'm picking out. This is from the ad agency. They told the funder, look at what we did. We got you a 6,588% increase in site visits. What's the problem? How can you have a 6,588% increase in site visits when the site did not exist before the campaign began? This, every time I mention this story, it kind of melts my brain because I'm terrible at math, but I did learn at an early age that anything times 0 equals 0. So I don't even know how this figure was arrived at. I still can't figure out how this figure was arrived at to this day. So anyway, report makes the agency look good, makes them look like they knew what they were doing. Well, we carried out our own look at the site analytics, website analytics, and drew a really different set of conclusions. One of which was actually sort of antithetical to one of the things we'd done, which was create a bunch of multimedia for a website. So the point is, how can the funder best use their funds in the future? I'm not saying that the multimedia wasn't successful. There were a whole other set of analytics, and there was a lot of good stuff that came out of there. But what we learned is that ads were less effective than press events that the funder had run, which is really exciting. So that brings us to transparency, the importance of showing your work. We have a challenge. Modern problems are complex. I tell my students all the time, all the simple problems have been solved. All the complex ones are left, and we've got to tell people about the complexity, and we've got to use English to do that. So it's really hard to explain it to lay audiences and professional ones and funders. And unfortunately, we do still live in a world where people believe there are quick fixes that there just usually aren't anymore. So it's critical to document what we're doing, explain the process, and continually better our practices in a sort of proof of concept approach. So it's up to us, all of us who came here today and all of us engaged in this work, to continue to promote and educate regarding this way of going about things. Yes, it does take time. No, there are no quick fixes. Yes, it's data heavy. Yes, it takes patience. But yes, it's also the future. It's the only way we're going to make progress on these issues. So when it comes to public health communication, our job is to approach communities with humility and an open ear. We got to use the right frameworks from cultural, theoretical, and data perspectives. We've got to involve the community, extremely important, through interviews, focus groups, observation, surveys, partnering with them on content creation. We've got to measure everything. And I think it was Senator Stafford who was credited with the slogan about Vietnam, declare victory and go home. We've got to resist declaring victory and going home. We got to be able to call a campaign a success, a failure, anything in between. It's incredibly important. All right, so now we've got our problems stated. We've got varied skill sets at the table. We've got a perspective and we've got a philosophy. What did all that end up doing, right? What did it look like when we created our proposal, which is still in front of the NIH, by the way? We've revised it, essentially. What did that look like? So project particulars. We relied on social norm theory, social network theory, and narrative theory, which I don't have time to go into today, and maybe you don't want me to anyway. but we proposed a student-led, student-created peer-to-peer campaign featuring dramatic, that is character-driven. People are creating characters. It's like they're writing a play. It's storytelling via podcasts delivered over social media over a period of a month. This social media includes personal accounts as well as an official account set up for the campaign. It's going to direct students to on-campus pop-up vaccination clinics. And we're going to collect data through focus groups, interviews, website and social media analytics, and clinic visits. So in other words, we've gone quite a ways from, you know, cute cats or lizards or that fried egg. Like by using that approach, it's pushed us in a much, much, much different direction. We're using the theories and the frameworks, and then we're measuring absolutely everything. Because again, it's not, we not only need to know whether it worked or not, but really more importantly, whether we were successful or not, we've got to let future communicators know what to do in their own campaigns so that we're not continuing this, like, I've got a pot of money, I'm going to pretend everything I did worked kind of dynamic. All right, so I'm in my last few slides. I want to wrap up part one and revisit one of our analogies, the tendrils. When you start thinking in cross-disciplinary fashion, you start asking people what they know and if they can help and who they know. And so here's where just some of those tendrils have reached over the course of our meetings over the last couple of years. We've got Gary Stein, who's actually one of the principals in NNECTR. Jan Carney, you may know her, obviously a very important presence in public health in Vermont for many years. Vermont After School Inc. If you ever listened to a governor's press conference, you heard of them because they were and are extremely active throughout that third space, is what they call it, when kids aren't at home and they're not in school. What can they learn and what can they do in that space? Vermont After School is extremely important there. People from the health department, Patsy Kelso, Mark Levine, district health, Department of Health offices, local physicians, Tom Delaney from UVM, Chip Cole, Peter Callis, Wendy Davis, and more from here. So a really broad range of people. And one thing that's near and dear to my heart, over the last 2 years, we've also engaged undergraduate social sciences students at UVM that I've roped into this project, and they haven't resisted too much. One of them is going to be starting the MPH program at UVM this fall. One of them is working in a human services nonprofit in the DC area. And one is a 2020 graduate social media professional and current member of our team, because social media is very important here, and understanding it on a minute-to-minute basis is really important. So my final tendril is leading to the second half of today's presentation. The NNECTR, remember the galaxy, we're not bringing that, the solar system rather, we're not going to bring that back just yet. But as part of what I was doing with the NNECTR to advance our proposal for the NIH was creating a paper, just Persuasion via Performance toward a handbook for youth to develop content that promotes HPV vaccination. It was all about how to use the theories, how to use persuasive language, social media theories and marketing theories and so on and so forth. It all went into there. And there's that existential question, will anyone ever read my paper? In this case, weirdly enough, someone did. It was Finlay. And so I want to just introduce Finlay briefly and then let her take it away. She's a student at Larner, looking to become an infectious disease physician, and she's from San Francisco Bay Area, but medical school is not her first stop. She's got a master's in engineering and worked as a geotechnical engineer in San Francisco. She's interested in reducing stigma associated with sexually transmitted and bloodborne infections, hello HPV. And she's done some really cool stuff since she got here. Created a walking group, people with HIV, trying to expand to monthly social events. Is interested in using narrative medicine to improve empathy for the unhoused in central Vermont. And she's working on creating an advocacy elective at UVM, which is really interesting. She wants to not only get her degree in as a doctor, but also with a sort of public health focus as well in advocacy. And I don't know how she has any spare time, but she claims to have at least some, which she spends with her husband and dog at their cattle farm. dogs, excuse me, I think I just said dog. Anyway, so thank you for listening to me so far. And Finlay, I am very proud to introduce you, and take it away.
Thank you so much, Matt, and thank you for everyone for having us today. I have to admit, we use Zoom in the med school, so I'm not very Teams literate, but hopefully I'll be able to figure this out. Uh-oh. Let me try that again.
You got it.
We can see your screen, Finlay, but I think we lost you somehow.
I hope you don't have to choose.
No.
I have her slides, but as a backup, but I imagine we'll get her back any second.
Yeah, let's just give Finlay a moment.
Oh my gosh, I don't think that
Hey.
worked.
We saw your slides, but we lost you.
I don't know what happened. I'm gonna try that again, and if it doesn't work this time, then I think we'll have to go with a plan. I just pressed share and then I pressed my PowerPoint. Am I doing
That
something?
should do it.
Yeah, that's what I was thinking too. I promise I practiced this too.
No
It
problem.
might be my Surface, in which case that's a med school provided Surface. Is it working?
We have you
Yes.
and we have your slides. Yes.
Is it in the correct view? Because my view is sort of a presenter mode with notes on the side, but you see just a regular. Okay.
Correct.
That's good.
Yep.
Okay, great. Sorry about that, everyone. That was a little chaotic. Yeah, so as Matt said, my name is Finlay. The title of my talk today is Collaboration in Action, Increasing HPV Vaccination in Rural Vermont. And the project and the research that I'm going to be talking about is something I did through an Albert Schweitzer Fellowship project. And so that is a national fellowship which creates year-long projects for different types of students in the Vermont and New Hampshire chapter. It's medical students and law students. And so we do year-long projects aimed at addressing social determinants of health. And so, as Matt mentioned, I'm really interested in infectious disease and sort of the intersection between that and stigma and public health. But what I'm hoping that both Matt and I can convince you of today is that even if your background or your interests are very different than mine, uh-oh, did it go away?
It did.
Oh no. I'm so sorry. I don't know why that's happening.
That's okay. It's totally fine. Maybe Matt could share slides. We still have you and your audio, so.
Does it, are you presenting directly from, yeah, that's fine. Oh, so it looks like you're going directly from PowerPoint. Is that what you're doing that's making it work, Matt? It's okay. Oh, this is not the correct,
I took my mic off.
this is not the correct version of it, I don't think, but it's okay. We can do this. We can make it work. We can make it work.
Okay.
Let's see. Yep. And I'll just say next when you can hit the next slide.
Okay.
Yep.
Right. Okay.
Yeah, so that was what I was getting at, is I'm hoping I can convince you that HPV research is very important to everybody, because the deal is that HPV is everywhere, and nearly all sexually active people will get the virus at some point in their lives. And HPV has been part of my life since around 2007 when I got my first vaccine. And I remember back then being so amazed that we were vaccinating against cancer. And well, that's not entirely true. It's not a huge stretch, right? HPV vaccination does provide protection against almost all cervical cancers and many anal cancers, as well as, like Matt was saying, cancers of the vagina, the vulva, the penis, and the oropharynx. Next slide, please. So we have this vaccine that can protect adolescents from a broad spectrum of cancers. And next, next, perfect. HPV vaccination rates still remain lower than those of other routine vaccines. And so just to kind of orient you with this graph, the blue solid line on the top is, this is a CDC graph, percent of people who have had one or more Tdap vaccines. That's tetanus, diphtheria, and pertussis. And then sort of the dot right below that is those who have had one or more of the meningococcal quadrivalent vaccine. So that's the meningitis vaccine, which is used as a comparison because, like the HPV vaccine, it was approved relatively recently, like in the past 2 decades. And you can see both of those kind of approach 90% as of the last estimate. But HPV, which is sort of that right below, the percentage that have had one or more is significantly lower. Next slide, please. And so that got me wondering what gives. And so when I was creating my research and creating this project, I really wanted to understand why people were sort of opting not to participate in this form of cancer prevention for their children. So you can hit next twice. Perfect. So I started my research by sort of trying to identify some of the barriers to HPV vaccination. So this was purely a literature review. And what I found was, and this is going to be kind of 4 nexts, they were healthcare inequity, racial and ethnic disparities, sex and gender-based stigma, and lack of knowledge about HPV were sort of pervasive barriers to HPV vaccination. But what I was most interested in is, so what does that look like in real life, especially in a place like Vermont, where one of the biggest barriers to good health is rurality. And what I found was, next slide, rural communities share these barriers. So they have, issues with healthcare inequity, of course, racial and ethnic disparities, sex and gender-based stigma, and lack of knowledge about HPV. And they also have unique barriers to HPV vaccination that are associated with rurality. So these can be things like access, as I mentioned, also older ages of caregivers, difficulty with transportation. And this is very important because residents of rural areas have decreased rates of HPV vaccination, and they also bear a disproportionately heavy HPV burden. So they have higher incidence and mortality associated with cervical cancer, particularly in Black, Indigenous, and people of color or BIPOC women. Next slide, please. So that brings me to my Albert Schweitzer Fellowship Project, which I chose to do in Lamoille County. And so all of these photos are bridges in Lamoille County. And because of my background in engineering, I sort of thought that would be a nice tie-in to have bridges and Lamoille. And so you might be wondering why Lamoille County? And there's a couple of reasons. And I think the primary one is because people in Lamoille were really excited about the project. And I think not only was it important to find people who had an excitement, but also, I started this program in 2021, so capacity. It was a global pandemic and people weren't so much focused on a vaccine that wasn't COVID, right? And they really had a need because, next slide. Lamoille County has one of the 5 lowest rates of HPV vaccination in the state. So only 48.1% of youth, based on the 2020 report, aged 15 had completed their HPV vaccine series. But you can also see that the other counties that are in sort of the bottom 5 are also very rurally located. But another thing I learned about Lamoille, next slide, is that on average, adults in Lamoille County are less likely to have had a doctor's visit in the past year than any other county in Vermont. And so there's really some interesting access issues in Lamoille County and kind of different data-wise than other Vermonters. Next slide, please. So now what? So I've got this research question. I've got some literature identified barriers to HPV vaccination, and I have sort of my community that I'm really excited to work with, but how do I figure out what to do and where do I go from here? Next slide, please. And I think the answer is collaboration. Oh, this is not the right. I have like this lovely little picture, and I'll just describe it for you instead of you seeing it. So I have a picture that's sort of a cartoon. Is it on there? Let's see if you can just next no picture. That's okay. The picture I have is sort of, it's a puzzle piece with 4 different windows in it. And the window is sort of showing how I sort of used collaboration to identify resources in the community. And the first little window is someone typing on their computer with a light bulb above their head. And that was sort of representing me with my idea and my research and kind of finding the problem and also the community. And then after that, I sort of did a bunch of cold calling. You know, I was reaching out to people and saying, hey, I can see that you're involved with HPV vaccination in the community. Can I add to what you're doing? Can I help with what you're doing? Is there some way we can create synergy so I'm not replicating your work or I'm not, you know, doing something in parallel to you that you're already doing? And through that, I was able to sort of strike gold through connecting with the NNECTR, like Matt was talking about. And then that quadrant of the picture is sort of like understanding how research is and the data is sort of interchanged in my project. And the thing that was the most helpful, as sort of Matt alluded to about connecting with NNECTR, is how much collaboration you can do from that sort of center of the universe. Because not only was I able to get great mentorship from Drs. Carney and Dr. Stein, I was able to connect with people like school nurses and like people who are very well renowned in the research community related to HPV vaccination, including someone whose research led to the development of the vaccine. So kind of through this center of the universe, I really love that metaphor, I was able to collaborate with so many different people and get so many different perspectives and methods. Like Matt was saying, I read his paper and I thought peer teaching, that seems really great. And the social learning I'll get to a little bit later, but from that collaboration, you can next slide. Yep, and then one more. Yep. Okay, so an evidence-supported, multi-component, peer-based approach. And so I sort of based the idea of my project around that paper that Matt wrote and this idea of peer teaching. And then from the literature, I added areas to support it with. So one is stakeholder engagement, and then there are 2 more you can just click through. School-based vaccination and awareness, and parent or guardian involvement. Okay, so next slide, please. So stakeholder engagement was a very important part of my project for a lot of reasons. The first one, next, please, is that rural areas are not uniform. I really can't stress this enough. The research about rural areas is very diverse, and it shows that, you know, rural areas differ, like Matt was saying, street by street sometimes, but they differ in factors like geographic location, sociodemographic factors, and even values, which make really unique challenges to HPV vaccination and the real need for locally appropriate solutions. You can hit 2 slides or 2 things for it. Perfect. They also are able to really identify local barriers to HPV vaccination and insight into what works in their community. And I don't know if I have it on here, but the other one that I really feel strongly about is collaboration. You know, it's not just collaborating with experts, it's collaborating with, well, I mean, they are experts, but different kinds of experts, right? Local experts and experts who know the area and people who have a feel for what will work in their community. And so kind of what I decided is that that was one of the collaborations that was sort of fundamental to my project, was listening to the people that live there and the people who have, you know, worked with HPV vaccination locally before. So that became one of the sort of foundational aspects of my project. And so you can hit next slide. And so before I sort of move on, I should mention who the stakeholders were and how I identified them. Next slide, please. And truth be told, this was very challenging. As I mentioned, I started this project in January 2021. So the stakeholders were really anybody who had capacity. Click, please. During a global pandemic. And as I'm sure you can imagine, trying to talked to high school faculty during a global pandemic. Was very challenging for both them and me to find time, and they were having shutdowns and going remote and coming back to school. And so it was really identifying anybody who had any bandwidth for, working with me on my project. And I was pleasantly surprised that that was actually like a good amount of people. I worked with faculty, with healthcare professionals. I worked with the local Vermont Department of Health, small business owners, parents, and even a few really amazing high school students. And my first question for them was, next slide, please. You can just click through this whole slide to get them. Yeah, perfect. That's it. These are the barriers that they identified to HPV vaccination in Lamoille. And so it was decreased access to primary care providers or attendance of well child visits, rigid gender roles, lack of HPV knowledge, and insufficient sexual health education. Okay, next slide, please. So what was really notable to me was that the barriers that the stakeholders identified in Lamoille County were remarkably similar to those that I had identified in my literature review. So on the left is sort of what the Lamoille County folks said, and on the right is what I independently identified in my literature review. The only difference really being that Lamoille County stakeholders didn't mention any racial and ethnic disparities, which makes sense because Lamoille County is predominantly white. And also insufficient sexual health education wasn't one of the barriers that I identified in the literature review. And you can next slide. I think I have that. Yep. So that one was really a challenging one because, of course, this is something I'm very passionate about. However, a lot of the HPV research feels very very strongly suggests that messaging for HPV should be decoupled from discussion about sexual health. And that's because there's this belief in a lot of parents that vaccinating their child against a sexually transmitted infection will result in disinhibition of sexual behaviors. And so as a result of that belief, a lot of the messaging is really recommended to be about cancer prevention and not about STI prevention. And so I got a lot of advice early on in my project. Don't talk about sex. Don't talk about sex. And the stakeholders felt that it wouldn't a peer-based approach would not be successful in their area if I didn't talk about sex and I didn't teach their kids about STI prevention. And next slide, please. I think that in a lot of ways they're right, because in Vermont, there's no requirement to teach medically accurate and science-based instruction about sexual health. They do have to teach sexual health, but they don't have to teach about HPV. And they also don't have to teach about sexual orientation or gender identity. And a lot of the teachers felt that their students didn't know enough about STI prevention and that their curriculum was really not inclusive of LGBTQ+ students. And so I really struggled with this a lot because the research was really strongly saying one thing, but my community was really strongly saying another. And I ultimately decided that because this was a project based on collaboration, and a lot of that collaboration, the people coming to my weekly meetings were stakeholders, I decided that it was really important to sort of do what they told me they needed. And so next slide, please. Unfortunately, in my newest PowerPoint, I had a great "let's talk about sex" image here, but that's lost to the to the change. So we did talk about sex. I augmented the curriculum with 4 80-minute sessions of inclusive, safer sex education. And so we really focused on STI prevention and sort of destigmatizing sexual health in the context of sex and gender related stereotypes. Okay, next slide, please. So through the kind of augmenting the course, with the safer sex education, I was starting to address some of the barriers that the stakeholders identified. So we had addressed insufficient sexual health education, next please, lack of HPV knowledge, next, rigid gender roles, but we hadn't addressed access, so decreased access to PCPs or attendance of well child visits. There's an X there. Okay. And so I also really wanted to do a lot more with education, and, you know, because of sort of the other foundation of this project, which was peer teaching, I wanted to make sure that was incorporated because I did a lot of the safer sex education myself. So next slide, please. Enter the Guard Your Health Fair. So the Guard Your Health was named for the 9-valent HPV vaccine, Gardasil 9, which is the vaccine we use in the United States for HPV prevention, or I guess cancer prevention, I should say. And so the fair was offered to 3 schools who share a campus in Lamoille County. So it was a high school, a middle school, and a technical school for 10 to 12th graders. And the fair was structured as a raffle where students had to learn from their peers about different health topics in order to answer questions on raffle tickets. And it's kind of hard to tell in this picture, but sort of around the perimeter of this room, there were different booths where the high schoolers had different health topics like using, you know, stopping a bleed, using an AED, splinting. You can see on the right, there's a skeleton with a splint, sexual health, vaping cessation. It was really, really great, sort of high energy event. And next slide, please. And so this is an example of a raffle ticket. There were 10 versions of the raffle tickets, and each of the 10 versions of the tickets had 4 questions. The first was about general health prevention. The second was about vaping cessation. The third was about emergency response. And the fourth was about HPV. And there was sort of a tab or a stub on the right. So you could have Guard Your Health on one side and then this QR code about vaping cessation on the other. And the reason I had so much about vaping cessation is, for one thing, a lot of the research shows that HPV vaccination events are more successful when it's not all about HPV. And also the community, when I sort of asked around what issues are really important to the community, everybody said vaping cessation. And so it was sort of a way to get buy-in from the community, and, you know, also like involve community organizations, because we had a local community organization talking about vaping cessation. Next slide, please. So raffle tickets that had all correct answers on them were eligible for, were eligible for prizes donated by local community organizations, including a Concept 2 row erg, which was amazing. But I was really pleasantly surprised that in almost 500 responses, next please, the majority of the questions were answered correctly. So it was really, really a great event. And next slide, please. And one more aspect of the event. Oh, I should also add that vaccination was provided at the Guard Your Health Fair for students who had a signed permission form. But 1 week before the event, we had this really special assembly. It was a remote assembly where the students got to hear the story of a male teacher at their school who was a survivor of an HPV-associated oropharyngeal cancer. And I just want to share one part of his story. So in his story, the student's teacher said he didn't remember anything about his diagnosis except for the beginning of the appointment and the end. And he remembered the beginning because when he walked in, his doctor was crying. The rest was a blur, he said, but at the end, his doctor told him that there was good news. Next slide, please. The good news was that a vaccine had just been approved for HPV, so no one ever has to go through this again. Next, please. And I just want to pause here because I think this is something that I've thought a lot about after this project. You can click. So I got to this great place where students were seeing people they trusted. They were their peers, their teachers, local health care providers, put a stamp of approval on an HPV vaccination campaign presented by a stranger. And seeing that was making it okay for them too. And not only is that very, very exciting and cool from a public health standpoint, but I've also learned after the fact from Matt that without realizing it, next please. You can hit one more. I was I was utilizing social norm theory, and more specifically social learning, which is something that I didn't know very much about, but Matt certainly knows a lot about. And the reason I say that is because I think so much of my project was based on collaboration, and that really helped it to be successful. But I actually think it would have benefited from me taking it even further. Had I known about social learning and social norm theory, I think I could have planned for that more and really, you know, like taken data about it and researched about it and kind of enhanced the project even more. So next slide, please. So I'd like to end with kind of like what I learned about transdisciplinary collaboration through this project. And it's sort of all summarized in this few sentences. And I'll just read it to make, because I know we're short on time. So I said, through our collaboration, we can defy the limitations of individual areas of expertise. We can utilize data and experience to apply research concepts to real communities in a culturally appropriate context. Our collective effort can allow us to improve public health outcomes, such as increasing HPV vaccination in rural areas in Vermont. Next slide, please. And that's it. Thank you guys so much. And thank you for bearing with me with my technical issues.
Thank you so much, Finlay. That is fascinating. And I know there are a lot of questions. I mean, I have several myself, and I am also looking at the time, which we are more or less out of. Unfortunately, I think we could easily go a couple hours with this one, because it really does put fingers into all these big complex projects and problems that are in need of being solved. So yeah, I mean, why don't we do this? If there's any real pressing motivated questions, or we'll take one perhaps, and then we'll just close it and wish you all a good day. So I'm going to pause for a minute, and sorry to put don't mean to load up someone's question, but if there's a fairly quick and motivated question, let's hear one. Okay, well, I see Andrew has put up a poll for today, and yeah, I do have some questions, but let's not get into it. I may follow up with you, Matt, because there's some stuff I'm sort of scratching my head on in a couple of projects I'm working on, and anyone else I would also say do the same. Reach out to Finlay or Matt with some questions relating to your projects if it involves this kind of work, which many of them might. Great. So I'll end just with one slide, and Chris had to, something came up with him. Chris, are you right there? I actually can pull up this last slide if you want, but you're welcome to close it if you're there.
No worries. I'm back, and I do have one question that I think might be helpful for the group. You know, as we explore new ways of engaging audiences and stakeholder groups, one of the things that I know we find in extension programming is the ways we measure the results of that engagement. And going back to Matthew's earlier point about transparency and our self-ethnographies, and staying true to the evidence. What are some reflections you both have on how these new methods of engagement and peer teaching, for example, what are some emerging evaluation methods that we can all learn more about?
Do you want to go, Finlay?
I can go briefly. So my main way of evaluating was through those raffle tickets. And I know that's sort of specific to my project, but that was a way of both evaluating participation, because how many tickets did I have, and also sort of engagement, because the questions were fairly straightforward. If you attended a booth and you know, engaged a little bit, you could get the right answer. And so that was sort of my way of engaging. I did some surveys afterwards also with teachers and parents to gauge interest, but that was my way of evaluating participation and engagement.
I'll just quickly add on to that, and thank you everybody for your patience, for hanging out. We thought we were going to be shorter today. I don't know why we didn't leave a whole bunch of time, but anyway, one of my favorite surveys, it's been run more than once, is asking people if they wash their hands after they use the bathroom, and sadly, men are much worse than women, even in admitting it. But the numbers are, we wash our hands when we use the bathroom, and you compare that with observational studies, and the numbers are very, very different. So the way I answer that is we look for as many possible ways to measure things as we can, and that needs funding and it needs explaining. So you do your surveys, you do your observation, you do your depth interviews, you use your analytics, and it takes time, but you can get a picture. You can absolutely get a picture, and it's so much richer than anything we've ever dealt with before. So all these analytical tools, the ones that have been around forever and the ones that have come along in the digital era, are super exciting. We need to keep fighting for them and for the funding for them, and we need to not accept, like, let's just fudge the statistics and take the friendly ones. Like, let's create a picture. But it really, like, the image in my brain is you keep filling in. It's like a big puzzle. You keep filling in pieces, and all of a sudden you do actually have something that you can work with. It's not just make believe.
I'm going to put you on the spot and say I hope Matt or Finlay, you might join a out of the box discussion next month about some of these techniques, because I think it would be great. I mean, I'm biting my tongue about some stuff that I'm thinking about, and I bet there are others. So anyway, you might be gone, but I'm going to reach out to you.
Do that. I'll definitely come. Yeah.
Right.
Any other burning questions? Again, especially folks who might have to leave for another commitment, please step forward and raise your hand in Teams or virtually or otherwise.
I don't know. It sounds like we have a question from Julie for Finlay.
Let's see.
Go for it, Julie.
Yeah, I don't know if you can see that, Finlay. So I'll just give you the question part of my longer comment that I left. I was curious whether you asked your target audience, whether that's the students or their parents, why they did choose to get an HPA vaccine, to see how they frame the benefit of that, which could give you more insights into how to position getting a vaccine like that.
Yeah, so I didn't do that. My project was sort of more about education, and I had the sort of vaccination, at the event, but it was definitely more about addressing the education part of it and the access part of it rather than the motivation. However, I will say there is a medical student taking over my project, and she's kind of taking everything I wasn't able to do and doing that. And so she's doing a lot of sort of parent events. So there will be a lot of questions like, why do you, why don't you, or why will you, why won't you vaccinate your child? And so I'm hoping to get some good data from that and from understanding motivations, but I was sort of more geared towards education. That's a great question.
Great. I think we are fairly well over time here, and we should probably move along. Chris, do you want to show that last slide, or I can, either way?
Sure, give me a second.
I'll just chime in. Thank you very much for coming, everybody. Good to see you, and we really appreciate it.
Thank you both. That was fabulous.